Hi everyone, good day to all of you. We are group 4 and we're going to talk about how does nursing informatics help to improve the quality of patient care and increase patient safety. Here we are guided by our learning objectives to tackle it with you. First, define nursing informatics and its role in healthcare. Second, explain how nursing informatics tools improve patient safety. Third, examine the role of nursing informatics in preventing medical errors. Fourth, discuss how informatics systems improve communication among healthcare providers and with patients. And lastly, understand the contribution of nursing informatics to quality improvement.
Hello everybody, my name is Anchal Gill and I will be discussing the role of nursing informatics in healthcare on behalf of Group 4. First, let's take a look on the definitions of nursing informatics. So the first one here is given by International Medical Informatics Association. It is a well-known organization that mainly focuses on advancing the field of nursing informatics globally. It says that nursing informatics integrates nursing, its information, knowledge, and their management with information and communication technologies to promote the health of people, families, and communities worldwide. Another most recent definition is given by American Nurses Association in 2014, which says that nursing informatics integrates the science of nursing with information, technology, and communication, and more recently, it incorporates analytical sciences to support the integration of data, information, knowledge, and wisdom into the delivery of evidence-based nursing care. Next is role of nursing informatics in healthcare. So it plays a very vital role in transforming healthcare into a more efficient, safe, and patient-centered system. It combines knowledge from nursing practice with information systems and technology to ensure that critical data is available to inform decisions and optimize patient care. First is improved continuity of care and information across care settings. So nursing informatics helps make sure that patient information can be shared easily between different healthcare providers like doctors and nurses. This ensures that everyone has the same up-to-date details to give the best care possible. Second is decreased incidence of duplicative diagnostic testing. By using technology to store and access medical records, nurses and doctors can avoid repeating tests, which will not only save time but will also reduce unnecessary procedures. Third is improved medication management processes. So technologies like electronic health records helps track which medications patients are taking, which makes it easier to avoid mistakes like giving a wrong medication or dosage to a patient. Next is increased engagement of clients and families in their care. So with nursing informatic tools like apps or online portals, patients and their families can be more involved in the care by easily checking health information and treatment plans which are available there. Next is improved access to care for individuals in remote communities. So nursing informatics uses technology like telemedicine or mHealth, which stands for mobile health and applications. These things allow people in faraway places to get healthcare without needing to travel long distances. Last we have is better information to inform healthcare improvements and policy directions. So by analyzing healthcare data, nursing informatics helps identify problems or trends which can ultimately guide decisions to make the healthcare system better. So these were all the roles of nursing informatics in transforming healthcare.
Okay, so moving on to how nursing informatics tools improve patient safety. So according to June Kaminsky, one of her journal of Canadian Journal of Nursing Informatics, she states that informatics plays a fundamental role in the promotion of primary health care through a variety of technologies and processes. This includes 5 tools. These are the electronic health records, or the EHR, telehealth, e-health, mobile health and application, or which is the mHealth, and the personal health records, the PHR. Talking about electronic health records, these are digital versions of a patient's paper chart designed to streamline the storage, access, and sharing of patient information within healthcare settings. These contain detailed information about a patient's medical history, diagnosis, medications, treatment plans, lab results, and more. While telehealth, this refers to the use of digital communication tools such as video conferencing, mobile apps, and remote patient monitoring to deliver healthcare services remotely. This also includes virtual consultations, telemedicine, remote monitoring, and health education. E-health is a broad term that encompasses the use of digital technologies, including the internet, mobile devices, and other digital platforms to support health services, improve health outcomes, and promote health literacy. This includes everything from health information systems and telemedicine to patient education resources and online support communities. While the mobile health and applications, or the mHealth, refers to the use of mobile devices such as smartphones, tablets, and wearables to support healthcare delivery. This includes also health apps, fitness trackers, and devices that monitor vital signs or other health metrics. Lastly, the PHR, the personal health record. This is a digital or electronic record of an individual's health information that is controlled and maintained by the patient themselves. PHRs also may contain personal health information, including medical history, medications, immunizations, allergies, test results, and lifestyle factors. PHRs are also typically portable and can be shared with healthcare providers at the patient's discretion. Okay, now moving on to how these 5 tools brought impact to patient safety. In electronic health records, this improves patient safety by providing comprehensive and accurate information. This ensures that all relevant data, such as medical history, lab results, and medications, are easily accessible to healthcare providers, which also reduces the risk of errors from incomplete or missing information. It also enhances medication safety through built-in clinical decision support systems, or the CDSS, that alert providers to potential drug interactions, allergies, and contraindications before prescribing. Additionally, HRs help prevent duplicate testing by allowing providers to access past test results and diagnosis, thereby reducing unnecessary procedures, minimizing patient risk, and lowering healthcare costs. On the other hand, telehealth. This improves patient safety first by providing timely access to care. This allows patients, especially those in remote areas or in emergencies, to receive healthcare without delay, which can be crucial for positive outcomes. It also supports early detection and intervention through remote monitoring of chronic conditions, enabling healthcare providers to identify signs of deterioration and intervene before complications occur. Lastly, this reduces the risk of exposure to infections, as remote consultations minimize the need for in-person visits, lowering the chance of hospital-acquired infections, especially during infectious disease outbreaks like the COVID-19. E-health improves patient safety by integrating health data from multiple sources, such as the hospitals, clinics, and pharmacies, creating a comprehensive and up-to-date view of a patient's health, which reduces the risk of errors from fragmented care. This also enhances medication safety, especially through e-prescribing. This eliminates risk related to legible handwriting, incorrect dosages, or pharmacy mix-ups. Additionally, eHealth platforms often include educational resources and automated reminders for medication adherence and appointments, promoting patient engagement and reducing the likelihood of missed treatments or follow-up care. Mobile health and application, or the mHealth, improves patient safety by enabling continuous monitoring of vital signs such as the heart rate and glucose levels through wearable devices and apps. This alerts both patients and healthcare providers to concern changes that may prevent serious complications. mHealth apps also promote medication adherence by sending reminders for medication doses, reducing the risk of missed treatments that could lead to worsening conditions or hospital readmissions. Also, symptom tracking features in many mHealth apps allows patients to monitor symptoms like pain or fatigue, helping healthcare providers detect emerging issues early and make necessary adjustments to treatment plans. Last but not the least is the PHR, the personal health records. This improves patient safety by giving patients control over their own health information, ensuring that healthcare providers have access to the most accurate and up-to-date data, which reduces the risk of omissions or misunderstandings that could lead to errors. PHRs also enhance communication by allowing patients to share their health information with multiple providers, ensuring that everyone involved in their care has access to the same critical data, preventing duplicated tests, misdiagnosis, or conflicting treatments. Also, PHRs help prevent medication errors by allowing patients to track their medications and treatment regimens, ensuring that they take the correct doses at the right time and helping providers identify potential medication interactions or mistakes.
So in this slide, I'm going to present the role of nursing information in preventing medical errors. So for that, we can use 5 rights framework in a critical nursing practice, that is right patient, right medication, right dose, right route, and right time. Start with the right patient. Nurse can identify the patient identity using two identifiers such as full name, date of birth, or medical record number. So basically, this step prevent errors such as giving medication intended for another patient. Second step is right medication. Nurse can check the medication label against the doctor's order to avoid and administering the wrong drug and the errors due to look alike or sound alike medication. Third is right dose. So nurse can confirm the exact quantity of medication to be given by calculating elderly or critical care patient are double checked to prevent overdosing or underdosing. Fourth one is right route. So nurses can ensure that the medication is delivered through the correct method like oral, intravenous, intramuscular, subcutaneous. For example, injection meant for oral use could lead to severe complication. Fifth one is right time. Verifies that the medication is administered at the correct time to maintain therapeutic drug levels. Nurses can account for frequency, specific timing, interaction with other drugs, or mix. So the significance of this framework is to minimize errors, improve patient outcomes, and foster trust in healthcare delivery. So moving towards the next slide, in this I'm going to represent 3 more methods to avoid medical errors, that is instantaneous access to information, communication across different disciplines, education, and providing feedbacks on mistakes. Start with the real-time access to information. In this, we can support evidence-based care, that is, nurses can access up-to-date clinical guidelines, research findings, and protocols directly through electronic system. Second one is decision support tools. It reduces the likelihood and enhance patient safety. And in the interdisciplinary communication, nurses can use tools like SABAR, that is Situation Background Assessment Recommendation, that provide a structured way for nurses to communicate critical patient information more concisely, and they can also use shared access to patient data that improves teamwork and reduce errors caused by miscommunication or incomplete information. So the last method is training and error method. Nurses include rules or simulated scenario that teach nurses how to prevent and respond to potential error. And they can also use error documentation and analysis. These components enhance patient safety, improve collaboration among healthcare providers, and foster a culture of continuous learning and quality improvement in nurses' practice. Thank you.
Informatics systems play a vital role in enhancing communication among healthcare providers and between providers and patients, like by leveraging technology to streamline information sharing and improve clarity. Especially for healthcare providers, tools like electronic health records offer centralized real-time access to patient information, ensuring up-to-date medical histories, test results, and treatment, which reduces errors and supports coordinated care, especially for patients with complex needs. Second one is secure messaging platforms. These platforms allow healthcare team members to communicate quickly and securely about patient care. Messages are encrypted to protect patient information, ensuring compliance with privacy regulations like Health Insurance Portability and Accountability Act. This fast and confidential communication reduces delays, improves care coordination, and enhances decision making. Next one is clinical decision support systems. This type of tools assist healthcare providers by delivering real-time alerts, reminders, and recommendations during patient care. For example, like they might flag potential drug interactions and recommend appropriate doses, or might be provide evidence-based guidelines for managing conditions. This ensures that the care is consistent, accurate, and aligned with best practice. Next one is telemedicine. Telemedicine allows providers to consult with specialists or conduct virtual visits with patients regardless of location. This is particularly beneficial for patients in remote areas by enabling consultations and access to expertise across distances. Telemedicine improves the quality and accessibility of care. Informatic systems also play a vital role in enhancing communication between providers and patients. The first one is patient portals. These online platforms empower patients by giving them access to their medical records, test results, and appointment schedules. Patients can also use portals to communicate directly with their providers, fostering engagement and transparency. Next one is telehealth services. It These services are very similar to telemedicine. Telehealth especially focuses on patient care delivery through virtual appointments. Patients can book or reschedule appointments online, reducing miscommunication and delays. This makes healthcare more convenient and accessible, especially for those with mobility or transportation challenges. Next one is automated reminders. These kind of systems send alerts to the patient about upcoming appointments, medication schedules, or preventive screenings, helping patients stay on track with their health. And the last one is mobile health applications. These kind of apps enable patients to monitor aspects of their health, such as tracking their blood sugar levels, blood pressure, or any physical activity. Patients can share this data with their providers for better management of chronic conditions and overall health. Lastly, informatic systems also provide transparency in billing and insurance coverage, improving communication about final aspects of care.
So now I'm going to
discuss about contribution of nursing informatics to quality improvement. First point is that improve patient safety. Automated alerts reduce medication errors. It explains that nursing informatics systems can generate alerts to warn healthcare providers of potential medication errors, such as drug interactions or allergies. This helps prevent mistakes that could harm patients. Another point is comprehensive client details for display and tracking. These systems provide easy access to a patient's complete medical history, including medications, allergies, and vital signs. This helps healthcare providers make informed decisions and monitor patient progress effectively. Second point is that enhanced clinical decision making uses data analysis and electronic health records. It allows for the analysis of large amounts of patient data. This can help identify trends, patterns, and potential risks, leading to better decision making. Another point is aids in timely disease identification and treatment. By analyzing patient data, these systems can help identify potential health problems early on. This enables timely intervention and treatment, improving patient outcomes. Moving further to next slide. Third point is efficient communication and working together efficiently. It covers 2 points. The first point explains about real-time communication among healthcare teams. Nursing informatics systems enable real-time communication among healthcare teams such as doctors, nurses, and other specialists. This improves collaboration and coordination of care, reduces patient wait times, and avoids unnecessary intermediaries. By facilitating efficient communication, these systems can help reduce patient wait times and avoid unnecessary delays in care. And the last point is assistance for evaluating and tracking quality. It also covers 2 points. First, explains that provides tool for measurement and data analysis. It offers tools for measuring and analyzing data related to patient care. This helps identify areas for improvement and track progress over time. Identifies area for improvement and implements quality program. By analyzing data, these systems can help identify specific areas where quality can be improved. This information can be used to implement targeted quality improvement programs. Overall, nursing informatics plays a crucial role in improving communication, reducing wait times, and enhancing quality of care in healthcare system.
Hello everyone, I am just Priya Chima. So I would be continue from the how nursing informatics can be applied to my future practices as a nurse leader. Here are the 4 points described in the slide. So first one is improve decision making and evidence based practice. According to the Heroin 2008, the article mentioned here in the reference, as a nurse leader, I would advocate the implementation of the clinical decision support system, that's CDSS tools that integrate evidence based guidelines into daily clinical practice. Here is the example, like when managing patient with chronic disease that are critical situations, CDSS, that is the clinical decision support system, can alert healthcare providers to the latest protocols for managing conditions like diabetes or the hypertensions that are very common but are the critical ones. So the research shows this support system can reduce medication errors, improve patient outcomes, and support clinical guidelines adherence. Second point is enhance communication and coordination of the care. According to the Alotebi YK 2017 article, I would prioritize fostering interdisciplinary collaboration and the communication through informatics tools like secure messaging systems and electronic health records. These tools facilitate real time update and the discussions between team members, thus reducing the risk of the miscommunication, particularly in the complex of the emergency situations. So it is find out the electronic communication system improve team communications and decision making speed especially. Third one is the reduce medication errors and enhance patient safety. As a nurse leader, it is prioritize the adoption of the optimization of the barcode medication administration and the computerized physical order entry system to ensure accurate medication prescribing, dispensing, and administration. Like while we administer medication to the patient, we check the errors. It would be advocate for ongoing training and audits to maintain staff proficiency and quickly identify issues. This sport, the study of the Poon at 2010 shows the barcode medication administration and the computerized physician order entry. We significantly reduce medication errors and adverse drug effects. Fourth one is the improved patient engagement and the empowerment. So, according to the Chen 2018 article, I would advocate for the use of patient protocols, portals, and the digital tools for enable patient to monitor their health, receive appointment reminders like pre-appointment, post-appointments, and communicate with their care team. By encouraging patients to actively participate in their care, like we do surveys after their care plan, like we can know about our on strength and weaknesses, how patient is feeling about their care provided by the healthcare professionals to them. That would foster the sense of empowerment and the patient safety, and a patient will feel prioritized. It is also found that the patient portals enhance engagement and self management, especially in the chronic disease care, that patient engagement to improve outcomes and the satisfaction. So I would continue with the summary and the conclusion. We have concluded the five major points from our presentation. First one is the nursing informatics plays a crucial role in enhancing the quality of patient care and improving patient safety by integrating technology, data, and the healthcare practices. As in the modern world, we use the different modern techniques related to the computer in the care of the patients. Second one is nursing informatics allows for more accurate, timely, and the coordinated treatment through the use of electronic health records, that are EHRS, clinical decision support systems, CDSS, and other digital tools. Third one is the technologies provide nurse with immediate access to the patient information, reducing the risk of errors while administering the medication and enabling evidence based decision making. Through real time monitoring and the data analysis, nursing informatics helps identify potential risks such as medication interactions and the change in the patient's conditions, allowing for practice interventions. Last one is the nursing informatics enhance communication and streamline workflow and support clinical decision making, fostering a more efficient healthcare information environment, improvement of the patient safety and the care quality. So here these are the 4 to 5 major conclusions we have concluded from our presentation that would help the medication system and the healthcare system in improving the quality of the patient care. Thank you.
This is our references by the group. So that would be all, and I would like to thank everyone for listening. Once again, we are Group 4, and have a good day.